Welcome to the deep dive. Today we're jumping into a really persistent debate.
A big one.
Yeah, a huge one. Natural remedies versus traditional medicine. We've been looking at all the arguments, and it's so much more than just, a consumer choice.
Oh, absolutely. It's a whole regulatory and really a philosophical clash.
Right.
And our goal today is to sort of cut through all that noise. We want to give you a shortcut to understanding the core of it.
So things like safety and how effective they are.
Exactly. Safety, efficacy, and when to use what, especially when the way each system defines proof is just fundamentally different.
Okay, so let's start with the appeal of the natural path. I mean, why are so many people drawn to it?
Well, I think a big part of it is that holistic idea.
Treating the whole person, not just the symptom.
Exactly. And it has this long history, right? Centuries of use, which gives people a real sense of control and even safety.
And what's the biggest claim they make?
The really big one is fewer side effects. And it's not just about being gentle.
Right, it's about avoiding the heavy hitters.
It's about avoiding the systemic impact of really powerful synthetic drugs. Our sources point to things like using curcumin for chronic inflammation.
Instead of a prescription anti-inflammatory.
Right. The goal is to rely less on powerful NSAIDs, which we know can carry some pretty specific long-term risks to your organs.
Okay, but this is where the tension really builds, because this is where traditional medicine comes in strong.
Mm-hmm. It's all grounded in scientific research, in randomized controlled trial.
That's where natural remedies can get a little shaky.
Precisely. We're talking about precise dosage and verifiable efficacy. You know exactly what 10 milligrams of a drug is going to do in the body.
That certainty is everything.
It's the bedrock.
And for serious illnesses or, say, an acute injury, that kind of certainty is, well, it's life-saving. You need surgery, you need targeted medications.
You absolutely do, and that really highlights a critical flaw in a purely natural approach.
Which is what?
It might be great for supporting wellness, maybe some symptom relief, but it often fails to provide that fast, targeted intervention you need to stop an aggressive cause.
This is definitely not a zero-sum game here. It's not one or the other.
Not at all. Both sides have serious drawbacks you need to be aware of.
Let's talk about the natural side first. The lack of standardization seems like a huge deal. It sounds dangerous.
It can be. An untested herbal remedy could interact negatively with a prescription drug you really need.
Or even cancel it out.
Or worse, be toxic if the concentration isn't standardized.
But then you look at the established system, and it isn't without its own massive costs.
Right. Traditional medicine brings clear burdens. The financial cost can be incredibly high.
Oh, for sure. And just getting access to care can be a huge barrier for people.
And we can't forget the well-documented risks of some powerful medications, dependency, addiction, some really severe long-term side effects.
Okay, so this is where it gets really interesting, I think. The sources we read point toward a modern movement.
The integrative approach.
Exactly. Practitioners are actually starting to bridge this gap.
Combining the two.
Yeah. They're combining the supportive, gentle nature of botanicals with the life-saving precision of pharmaceuticals. It's all about optimizing patient care.
But if we zoom out from that, the biggest challenge facing this whole integrative movement is, well, it's regulatory.
All rules and standards.
This model to really work, every health decision needs reliability. That means we have to validate centuries of anecdotal wisdom using modern clinical trial standards.
That sounds like a truly massive undertaking.
It is. It's about standardizing the efficacy and dosage of the world's entire ancient pharmacopoeia.
So whether you lean natural, traditional, or you're thinking about that combined approach, the final actionable takeaway is this. Always do your own thorough research. And crucially, never start or adjust anything without talking to a licensed medical professional first.
So that leaves us with a final thought for you to chew on.
Let's hear it.
If the future of medicine truly is integrative, the big question is, how quickly can clinical research catch up and validate all those centuries-old remedies?
Before what?
Before the next generation of synthetic drugs just leaves the whole discussion behind.
Wow. Something to think about. Thanks for diving deep with us.